We started working to standardize the data warehouse. Shortly thereafter, the team stood up our real-time API to provide more consumer-friendly lab order names in the patient portal that you support. And then most recently, we automated some of the clinical data pipelines and are on average normalizing about 3 million terms per month. And by the analysis that we've done together, 84% of the time roughly, that uncoded data is resolved to standard codes without human intervention. What did, just as a point of contrast, what did that data cleanup process look like beforehand in terms of, right, contending with that problem of poor data quality and trying to make your obligations for reporting and certainly serving the recipients of that information haven't changed. So can you maybe walk us through a little bit of that as we think about the meaningfulness of that 84% of hands-free normalization for folks that are responsible to data governance?
I mean, the 84%, we can talk about the 84% down the line as a metric by itself. But the point here is when we started this process of normalization, how things flew into is on a regular basis when we started onboarding systems, like let's say we onboard a particular entity or a hospital, a facility that comes into our infrastructure. So there is an ad hoc process today. So what we do in that ad hoc process is during our onboarding, we pick a sample of messages and we see during our UAT or testing of the systems, we see if all the data that comes into the system follow our compliance or our standard. So our goal here was how to actually make sure that we provide near real-time feedback back to the producers of the data, in this case, the EHR systems, how good the quality of data is, and what are the gaps that we have in the data that can actually be articulated meaningfully at the time of ingestion during onboarding. And then not only during onboarding, also to a point of efficiently running it over a period of time to produce those feedback back to those entities for standards and interoperability altogether. Exchanging meaningful information to meaningful use all comes back to those using terminologies, right? So that's one thing that we've manually been doing for quite some point in time in our onboarding processes. So what we did with IM was specifically looking at ways by which we could automate this standardization and also connecting it back into our scorecards per se. So every facilities would have its own scorecards. These scorecards are basically compliance to the standards on how good the quality of data that we're getting in our system is. Why does this matter? Because anything downstream, you brought up the point of pandemic, right? So during that, the ICD codes for COVID was almost misnumbered or misplaced or interchanged across descriptions and code systems. So being able to actually capture them all to aggregate to a common number, which we then use to send public health in near real time to actually produce reports which influences their policy and decisions at a public health level. So that was useful in how we actually automated, right? So being able to look at this continuously as part of our continuous development and quality improvement. So that was one of the key things that we were able to achieve in the process of automating it. So in short, the way how we approached is essentially dividing it into two parts. The first part is at a transactional level, standardization and normalization. The other part is at a historical level, or looking at entire data warehouse level standard codes, distinct codes, and running them, refreshing them over a period of like, let's say 24 hours or a weekly cadence or a monthly cadence, and then run those reports back. So that's pretty much how we approached this. Overall, that's the way how we have automated to the point of 83% almost near real-time matches.